Welcome, and thank you today for joining us. We are going to be talking about end-of-life doula care. So we just want to take a moment to appreciate that this can be a very big topic, and it can be very close to some of our hearts. So just to have grace and be mindful of others in the room and how they might be handling this information and sharing. So we'd like to start with that. Our presentation is going to be presented by Betsy Rivera, myself, Jennifer Jensch, and Jody Sharp. So what is an end-of-life doula? A death doula, sometimes referred to as an end-of-life doula, provides support to individuals and family during the end-of-life process. Their role is to offer emotional, physical, and practical assistance to help make the dying process as peaceful and meaningful as possible, leading to what we call a good death.
So what is a good death? Does anybody have an idea what you think a good death is? One that's comfortable. Okay, one that's comfortable.
Find out what your stuff is.
Find out, good.
Without suffering.
Without suffering.
When people are prepared.
Prepared, yeah, sure. So all of these things can are encompassed in what we call a good death. And a good death is tailored to every individual. So every individual has a different definition of what a good death is. And that could include, having something prepared, but it can also include the environment that you're in, who you want around you, and if you want medications, if you don't want medications and things like that. And that's where an end-of-life doula comes in to help guide someone to that good death. And so the core attributes of an end-of-life doula are these four up here that we have: communication, organization, knowledge, and values and ethics. So with communication, we want to make sure that an end-of-life doula is communicating with the patient throughout the entire process, as well as communicating with the family around them, whatever those needs are of the patient. We also want to make sure that we are creating these key relationships between the family members and those close to the patient who is at end of life, and being an active listener and hearing out these individuals. With organization, I consider an end of life doula as a glorified secretary. So an end-of-life doula, wants to help provide the information to the patient and their family members as easily accessible as possible and as organized as possible. So whether that involves advance directives or funeral planning, we want to provide all of that information to the patient and their family and loved ones in an organized manner. With knowledge, that includes all of that information, right? So providing information on hospice and what that includes, providing information on, like legal requirements, spiritual support and bereavement support, right? With values and ethics, that goes into confidentiality. So making sure that what is discussed between the patient and the doula is confidential. And those who need to know are in the know, as well as, providing those professional and personal boundaries. That includes, not inflicting our own beliefs onto the patient and their family. So, for example, if I identify as a certain religion and the patient or their family does not, we don't want to impose our own beliefs onto them. The focus is the patient and their family the entire time.
So what can an end-of-life doula provide to the family or the person? They can provide non-medical support. The role and scope of a doula is a non-medical role. They can provide emotional comfort, information sharing and education, that proactive guidance, resources and referrals to community partners or benefits, comfort, measure physical support, ideas, and logistical assistance. Some of the supportive tasks end-of-life doula can do kind of touches on different aspects. We have the emotional, the practical, the spiritual, and the physical. Emotional, we can be that calming presence. We can utilize our active listening skills. We can assist with legacy work. Betsy had mentioned how the person would like to be remembered at the end of their life. So this could be going through photos, making a slideshow, offering ideas for services just to honor the person who has passed. So some of the practical tasks an end-of-life doula can assist with is coordinating care circles, arrange space in the home, simple household tasks and errands. On the spiritual side, work on guided imagery, meditation. We can sit and read to that family member, just have that presence. And physical, again, non-medical symptom management, education on the end of life and stages, and hand-on comfort and repositioning. So what end-of-life doulas do not do? So for medical, we do not perform clinical tasks. So medications, like dressing, wound cares, that kind of thing. We don't give medical advice or persuade clients to follow specific treatments or courses of action. On the emotional side, again, we don't impose our values onto them or the family members. We don't underestimate or undermine clients' confidence in their caregivers. We're here to support, all the functioning members to their care team and talk them up and encourage them. So we offer presence. We do not usurp the role of other essential professionals, and we do not provide sole support. We are just a part of that working team. So Jennifer's going to tell us, when does an end-of-life doula come into play?
Yeah, so we kind of have a timeline for services. We have an individual who is healthy and then has illness, a terminal diagnosis, dying in hospice, and then after death. So we should be coming in at the terminal diagnosis. That doesn't mean that we cannot assist before or after. This is just kind of the sweet spot for our bag of tricks. What we're able to do comes in the most helpful at this time, the terminal diagnosis. That way it gives us it allows us time to get the paperwork together, do the whatever they're wanting to have that peaceful death. This is just the best time for us to come in. And again, not saying that we can't help before or after. This is just where it makes the most sense. And part of that is the 95-5% rule. So only 5% of a dying person's time is spent face-to-face with a medical professional. This is why that time is the perfect time for us. And what are we as a community doing with the other 95% of the time, right? Well, end-of-life doulas are stepping in during this time. And you might have resources and support from other areas such as friends, families, churches, things like that. We're just like an extra support from it. And then what quality of support are people receiving and from whom, right? So we've been trained in this. We've done the certifications and everything to bring these services to your friends and family. And this brings us to a wonderful quote that death is a social event with a medical component. So you saw that 95 and that 5. 5% is the medical, 95 is not medical. So not a medical event with a social component. So it's important to remember that, which is why we are here today.
So a couple examples or a couple cases in which an end-of-life doula can come into play. So our first example, Susan, she's lived independently for the end of her life, and she prefers to pass at home. She established care with an end-of-life doula prior to hospice admission, so this is where that timeline comes in. And during this time, we were focusing on psychosocial and emotional struggles that Susan was struggling with or going through. The doula participated in weekly RN visits, advocating for the patient. So that's where the advocacy portion comes in, where the doula can step in and make sure that the patient is getting all of the information that they need and making sure that their voice is being heard. So home health aides were hired for the last month of the patient's life, and the end-of-life doula supported during that process. And they were able to peacefully die at home per the patient's wishes, and the doula was a part of that entire process. Another case is Carol. She was living at home and was alone for about 12 to 14 hours due to family schedules and things like that. They were alone most of the day, and were on continuous high flow oxygen and were unable to go outside their home due to COVID-19 and other environmental conditions that did not allow the patient to leave their home. Initially, they did not want hospice. I believe primarily was for the reason that they just weren't too sure of what hospice was. So they had twice a week visits with an end-of-life doula, focusing on education and that listening aspect. So the end-of-life doula was there to provide all of that information to the patient about what hospice is, and was there to listen to their concerns throughout the whole process. 6 visits later, they were ready for hospice and stated that it was less scary. And they were admitted 2 days later and passed away 3 days after that. So those were just some examples. And though the term end of life or death doula is relatively new, and therefore statistics haven't fully been published yet, but there has been a lot of anecdotal evidence and that suggests that an end of life doula can improve the experience of someone who is actively dying, and can overall lead to a more peaceful and dignified end of life. They also, end-of-life doulas also have the potential to reduce any medical costs towards the end of life by providing the support and preventing unnecessary hospitalizations and medical interventions. And so an end-of-life doula and the rise of end-of-life doulas are moving towards a more holistic and compassionate approach to end-of-life care.
So what are some misconceptions about end-of-life doula? One of the big ones is it's just for the elderly population. That is not true. We act at all ages, and it's not only for people that are on hospice, it's pregnancy loss. I am here if you've lost an animal. I can be a support or a presence just to get you through it and to guide you through. So end-of-life doulas can support anyone facing the end of life. Also, another myth is you must utilize a funeral home in Oregon. Actually, in all states, it's legal to have your loved ones at home after they pass. Oregon doesn't require or require you to involve a licensed funeral director in making or carrying out final arrangements. But I will say the one we have in town is lovely, and he will guide you in the right direction. Another end of life myth is why the terms death doula and end of life doula are relatively a new term. The role of guiding individuals through the end of life has existed throughout history in various forms. Traditionally, this work has been done by family or spiritual leaders, community caregivers who provide support and comfort those people needing death. Today's death doulas are continuing this long-standing tradition and but offering more of a modern approach to this timeless practice.
And there are many different trainings and certifications out there. However, there's not a standard yet. We suggest, if you're interested in looking into training or certification, that you go to the International End-of-Life Doula Association or National End-of-Life Doula Alliance, NEDA. And you can go online and get certified, a quick class and you're done. Whereas these certifications are multiple weeks of really immersing yourself into the position and really how you're going to assist others the best. So we suggest them. And then we have other resources, one of those and the biggest being our Good Shepherd Hospice team. We always love to build them up and give them kudos. They are a great support and someone that we enjoy working alongside. Personally, I have a family member who is on hospice, and they just are an amazing relief and can come and teach how to do massage and just make your family member more comfortable. So we just appreciate them. We have Peaceful Presence, who we did our training through. They're a wonderful organization. We have CODA Health, and CODA is really helpful to get all your paperwork in order. It's just like you go in and do these little questions one at a time, and you can take however long you need, and it puts everything in order for you. And then we have the Oregon Office of Rural Health through HSU and Public Health Palliative Care International.
And I would like to just add, if you get anything out of this, advanced directives.
Yes.
You should all do one. They say 18, you should be thinking of it. It's a hard topic, but it's good. You can update it. It's not set in stone. We can help you with that advanced directive using the CODA website or going through the forms online. So that is a big one. Everyone should have one.
So we will now open it up for any questions that you guys might have. Feel free to ask